Assalamu alaikum, I'll be talking about shock. Shock isn't a problem of circulation, it's a problem of perfusion. In other words, how does the blood reach the cells? Or more importantly, how does the oxygen reach the cells? What I mean by this is, let's take an example. So the better part of winter has just passed by us. Imagine somebody grabs his favorite bit of timber, calls up his friends or family, they huddle around the fire and start talking for a couple hours. Eventually, one of them collapses. They take him to the ER, they discover he has shock because of carbon monoxide poisoning. Now what's the moral of this story is the fact that shock isn't a disease of itself, it's the result of something. But it's still an emergency. And just like every other emergency in medicine, we have to maintain stability of the patient. In other words, just for now, imagine like keeping the blood pressure, heart rate, and respiratory rate within an acceptable range. And every patient in emergency, we give them fluid and oxygen. Now, this is basically the medical equivalent of that piece of chocolate you find in a hotel room. We give this to every patient. Now, there is a silver lining to shock, is the fact that this fluid that we give to the patients is effectively the treatment of shock. So treating shock isn't the difficult bit. It's being able to identify that this patient has shock or is in shock. Okay, so generally shock is because of either a problem with the pump, in other words the heart, a problem with the volume, in other words the fluids, or a problem with containers, in other words the blood vessel. To better explain this, I'm going to be using an analogy. Imagine you're in a carnival. The carnival master walks up to you and offers you to play a game. He gives you a tube, think of it like a garden hose. At the bottom of it, it's attached to a water balloon, and he puts a mark, say, in the middle of the tube, and tells you that you have to keep pumping. And you have to make sure that the water level reaches above the mark. If it reaches below it for, say, 10 seconds, you lose the game. Alright? So you keep pumping, you pump, and you reach the mark, and you're well above it, you're fine. Eventually you realize that you're no longer reaching the mark. You wonder what's wrong, you look at the water balloon, half of the fluid is gone. You're not sure why, but the fact remains is that you've lost fluid. You know that if you keep pumping the same way you are, you'll never reach the mark. So you start pumping faster. In other words, the patient will have tachycardia. And because the fluid on its own will not reach the mark, in other words, the patient will have hypotension. Alright, you try to compensate in another way. Start constricting the tube. The patient will also have vasoconstriction. In other words, he'll look pale, he'll have cold and clammy hands. Okay, so you try to compensate. But what is the treatment? The patient lost fluids, so you simply give him fluids. You've dealt with this type of shock mainly. But, like I said before, there is an underlying cause. You could have lost fluids, for example, vomiting or excessive diarrhea. Think of like dysentery. Or, much more worse, is bleeding. Because even if you give him fluids, if he's bleeding or still constantly losing fluids, he is never going to be stabilized. So you have to stop the bleeding or stop whatever is actively causing the hypovolemia. Alright? Let's go with the other one, cardiogenic. So you've been pumping for the last 5 minutes, you really want that big teddy bear. You pump, eventually you start feeling cramped. You start feeling cramped, and your hand starts to hurt, but you keep pumping either way. Eventually your hand becomes so painful that you're no longer pumping, you're just jittering. Water is no longer moving, it's just stagnating. And one extra sign you might see in cardiogenic is the fact that the jugular vein is distended. This is because fluid is no longer going through the heart, it's just stopping before it. Now, in the case before it, you could compensate. Because the heart is still moving, you're still pumping fluids. You can compensate by constricting the vessels. Here, the pump itself isn't working. If fluid is not moving through the tube, what's the point of constricting the tubes? This is why cardiogenic is very lethal. Because once the heart stops pumping, or effectively stops pumping, the patient can't, or the body can't really compensate. So in this case, you have to give them medications to increase his heart rate or contractility. Alright, let's go to the next one, neurogenic. So you pump, everything is going fine, and you realize the carnivore master might be cheating a bit. Because at the start the tube was maybe the size of your pinky, now it's the size of your fist. The tube dilated extremely or excessively. Now you realize that no matter how much you pump normally, the fluid will never reach the mark. If you notice, this is very similar to hypovolemic. The clinical pictures are very similar, except here the problem is vasodilation. So there I said he became pale and cold and clammy hands because of the constriction. Here, no, his hands might be even warm. They won't be pale or cold. Okay, so the problem here is with the tubes itself. You can give fluids, and you should always give fluids. But to treat it, just constrict the vessels. The patient lost sympathetic control of the vessels. You just give a vasopressor, and voila. Alright, next would be anaphylactic. Okay, admittedly, anaphylactic doesn't really work with this analogy, but the general mechanism is similar to neurogenic, is that the vessels have dilated. Alright, constrict them. Give them a vasopressor. Here, epinephrine works best. It's always available, it's cheap, and it's effective. It works in multiple modalities, so it's good. You also give bronchodilators. He's going to have constriction that's threatening his respiratory rate. Remember what I said at the start? That in every emergency you have to make sure he is stabilized. If he can't breathe, he won't be stabilized. So give a bronchodilator. Alright, now treat the cause. That's one advantage to anaphylactic. Maybe someone will come with him telling you that he has an allergy, or he might come with symptoms of shock plus symptoms of respiratory problem like breathlessness or coughing. So it'll be a bit more obvious that it's anaphylactic. So we can immediately start treating the cause. Give him either antihistamine or corticosteroids to reduce the inflammatory reaction. Alright, next would be septic shock. Somehow, some why, for some unexplicable reason, a rat decided to jump into your tube. It went into the tube, it reached the balloon, and it's going to start scratching at your balloon. Eventually it will pop and you'll lose the game. So you can't really keep pumping with the rat in there, you have to remove him. So what do? You dilate the vessels, try to get your other hand in and try to pull out the rat quickly in under 10 seconds. Alright, so there's going to be vasodilation and septic shock. And let's be fair, you're not going to pull out the rat in 10 seconds, so unless we act quickly, the patient will die, just like in any other shock. But here's the difference. Even if we eventually pull out the rat will be soaking wet, and it's a rat, so it probably drank some of the fluids in there. In other words, there's also going to be a loss of fluids, excessive loss of fluids. So, we have to give antibiotics to treat, or not treat, to kill the rat, but also have to give aggressive fluids. Why? Because the patient might be feverish, he might be sweating profusely, losing water. Again, like hypovolemic. Just like there, I said you had to treat the cause, or he's just going to keep losing the fluids. Or he might be losing fluids from his capillaries going to the extracellular space. So his body still has all the fluids, but it's not in the capillaries or the blood vessels, so you have to give fluids. But just like anaphylactic and neurogenic, there's going to be vasodilation. Remember, we had to dilate to remove the rat. So then we give vasopressors to constrict it, you give fluids, and of course remove the fucking rat. Lastly is going to be obstructive. Okay, so you realize that this carnivore master is cheating. He placed a rubber band at the intersection between the water balloon and the pipe. In other words, you keep trying to pump, you try your strongest to pump, but water is not going up. This is very similar to cardiogenic if you think about it. There you eventually reach a point where fluid will not move, it will stagnate. This is quite similar. In other words, you have to remove that rubber band. You have to remove whatever is causing the obstruction, because eventually the fluid will stagnate. And even if you try to tough it out and try to push harder, pump stronger, you'll eventually will cause some muscle spasm to your hand and eventually reach cardiogenic shock. So you have to treat the cause. If it's, for example, pulmonary tamponade, treat it. Alright, next up, we finished the juicy bit. We now go a bit into the physiology. Now, blood pressure is mainly from peripheral vascular resistance and cardiac output. Peripheral vascular resistance is, like we said, anaphylactic and septic. The vessels dilate, the blood pressure will drop. Alright, now cardiac output. Let's take some examples. With contractility, we already talked about cardiogenic. You can't pump, water won't fall, won't move, blood pressure will drop. Patient will go into shock. Let's talk about preload. There is no fluids are going to the heart, so you can't really pump them. Hypovolemic. Afterload. Okay, there's the rubber band. There's something obstructing you from pushing the fluids out of the water or the heart. In other words, it's going to stagnate there. No movement of water, the real drop in cardiac output. Alright, next up would be the compensatory mechanisms. I won't get too deep into them since you're going to have the renal block soon and they'll get into much deeper details. But the first one is cardiovascular. This is what we've all been doing this entire time in the game. When there was a low fluids, we started pumping faster, increase heart rate, increase contractility, and we try to constrict the vessels. This all happened in hypovolemic shock. This is just like how we actively treated this or did this in the game. The body is actively doing this via sympathetic nervous system. Now there is another system, also the renal. Again, I won't get too deep into it, but generally the kidneys realize or get sensitized by low blood pressure, so they release renin. Renin eventually will become into angiotensin II via the lungs and liver, and this will vasoconstrict and will stimulate aldosterone, and it will eventually start retaining salt and water. There is also antidiuretic hormone will also work in a similar manner. It will detect low blood pressure, it will release antidiuretic hormone, and it will also retain water and salt. Alright, now lastly this table. Okay, anyone that's going into surgery, emergency or trauma, you should memorize this table. Not today, not this week, not in the next couple of months, but keep this table on hand, you'll need it. Now what do I mean by this? This table helps you dictate what fluids to give, as in blood or crystalloids, or blood or crystalloid. For people that are going to surgery, this also helps you to dictate what signs are expected after the surgery. So let's say that you do a surgery in the humerus. You expect the patient to lose between 750 to 1,500 milliliters of blood. So expect class 2 symptoms. This is normal, not very bad. Maybe one or two things might be class 3. That's fine, not too alarming. But let's say you work on the humerus, you finish the surgery, and well, the nurse tells you, okay, the respiratory rate is 40, or sorry, more than 35, and there has been zero or effectively no urine output in the last couple of hours. Okay, that's alarming. That means the patient is actively bleeding. You might have nicked an artery, or he might be bleeding internally. Something's wrong. This table helps you understand or signify that something's wrong. For people that are going into trauma or emergency, just like I said, this helps you with deciding about fluids. All right, thank you, and that's the